Hi, I'm Lacey. I'm going to be doing a catheter insertion, a urine sample, sterile urine sample, and taking a catheter out today. Julie is videoing for me, so I'm wondering if she can show the room really quick. She's sitting, so she's just showing around. Okay, wonderful. Thank you, Julie. So to start off with, I would be, oh, and I was allowed to wear my jeans because we're videoing a little bit early because of the storm. So the first thing that I would do before I entered the patient's room is I would confirm the orders that the healthcare provider provided, and then we would come in and we would knock. I would perform hand hygiene. There's nothing in there. Actually, I want to perform hand hygiene. Hi, I'm Lacey. I'm going to be your nurse today. Can you verify your name and your date of birth for me, please? Shirley Post. Date of birth is correct. Wonderful, Shirley. So it looks like we have an order for an indwelling catheter, and so I'm going to be putting that in today. So what this will look like is we'll get you all cleaned up, and then I'll have you kind of spread your legs apart, and you'll feel just a little bit of pressure when we insert the catheter, but this is a thing that we need to do now. It's going to help you feel better and relieve a lot of the pressure that you have right now in your bladder. So before we do that, would like to look, just verify. Okay, yep, and then will you verify any allergies for me? Okay, so you don't have any allergies to latex or betadine?
I just want to look at your orders there to make sure that it's not.
Oh, yeah. You can see these are my orders.
Okay.
Yep. So no allergies there, so we are good to go there. I have let people know that this is a private procedure, so there is a sign on the door letting people know that they need to stay out. And then we have all of our supplies ready to go for this procedure as well. I'm gonna go ahead and get the bed lifted up a bit because I am tall and I need the bed to be at a comfortable level. Do you have any questions before we get started, Shirley? No? Okay, wonderful. So I'm gonna go ahead and I'm gonna expose you here, but we'll try to keep you as comfy as possible while we do all of this. I'm just gonna roll my blanket down. I would have a bath towel as well, and I would be covering her up here, making sure that she's nice and comfortable and exposed. I'd have her hold on to that towel, and then we would just expose the area that we need to be looking at and cleaning today. The first thing that I would do is perineal care, which we'll just verbalize today. I would, while I'm doing that, I would be checking, I would make sure that I have my gloves on first thing. And these do not need to be sterile gloves, so I would just put, we won't use any gloves today because we don't want to waste them, but while I am doing my perineal care, I am just making sure that her anatomy looks, everything looks like it's supposed to, and that I can kind of visually see that is good. So we've done that. She's dry and ready to go. So now I'm going to go ahead and have her lift her knees up, and then we're gonna have her kind of frog her legs out as much as she's capable of doing. Is that as comfortable as you can be there, huh, Shirley? I'm sorry. It's gonna make you feel better, I promise. So just some light pressure there. I think that's as far as, she's not very flexible. Okay, so now we have that done. I'm going to, once again, perform my hand hygiene. Actually, before I do that part, I'm going to put a checks underneath her. Okay, here we go. Just so we've got, if there's any fluids or anything, that's all. And that would be a clean one after I'd performed perineal care. We'd put that underneath. Okay, so hand hygiene. We've got our, maybe I'll turn it this way so you can see it better. We've got our catheter kit. keeping that at the end of the bed. Be there. So now I'm opening my catheter kit. This is very important that we're using sterile procedure for this. Reaching, we're getting everything opened, and I open my flap away from me first. And I am only touching the 1 inch edge of the packaging to ensure that we are staying sterile. I'm gonna rotate it. Now, and now I'm just gonna like move that right over there. So next we're gonna get out sterile gloves. I think we will do that right here so that I have enough space for that. Once again, just making sure that I'm only touching the outer edge. Okay, and not the surfaces at all. I'm gonna do my non-dominant hand first. Sterile gloves on. I'm gonna get this a little bit closer. So the next thing that I'm gonna do is I'm gonna take my separate sterile field. I'm going to open that. My gloves are sterile now, so I can touch this. I'm going to take this. To, without touching anything on the patient, the bottom side of this can touch the patient, but we're gonna lay that down right there. I'm keeping my hands up. If this was a male patient, I would be using this as well, but I'm just setting this to the side because we have a female patient. So next I'm gonna get my slabs out. Getting my supplies ready. I would get my lubricating jelly and that I would squirt out into my container. But for the purpose of this video, we're just gonna pretend that that would be right there. And then I would be taking my catheter out. We would be attaching my sterile water. So we have our catheter ready to go. We have our jelly ready to go. I'm gonna set this back down so all of that is sterile. I have my stop sticks ready. nose. And I am, at this point, actually, I'm gonna put that there. I'm going to take this off of my catheter, maintaining that I stay sterile. That's just gonna fall to the side. That's all touching sterile tubing. And then I'm going to go ahead and stick this in my jelly that I have ready to go here. And move all of this to my sterile field in between my patient without touching. The patient's very inflexible, so without touching that there. I can have this can touch the patient because that does not need to, but that would be out there. So typically this mannequin's legs are not very far apart. This is making it a little bit challenging to keep all of that from touching, but that is how we would be there. So we would be just right there. Okay, all of that there. So next, I have everything set up and ready to go. So I'm going to inform the patient that I'm going to be touching them. With my non-dominant hand, I would spread the labia without touching. I would clean outer on the side away from me, top to bottom. This will get thrown away by hazard, I think, without breaking sterile field, going below my waist. Then I would do middle, top to bottom, throw it away. And then I would do the side next to me, top to bottom, throw it away. We would throw that away also. I still have the labia spread, and at this point I would make sure that my catheter is not touching her legs. It's kind of a challenge in this situation. That's okay. So I make sure that my catheter has been in the lubricating jelly. I'm going to make sure that 1 to 2 inches of the catheter is lubed. And then I'm going to tell the patient to bear down while I insert the catheter. So we will be inserting. Please bear down. I think you're good. I think you can back up a little bit with the camera. Not touching the patient while I insert. I'm going to insert, because it's a female patient, I'm going to insert 2 to 3 inches until I see a flush of urine in the bag. And at that point, I'm going to insert another 1 to 2. And then I'm going to hold the catheter in place with my sterile hand. I'm going to cross over and I'm going to inflate my balloon. I'm actually going to try to do that here. Let's see if we can do that. Sounded like something was happening there. Okay, my balloon has been inflated. Okay, I'm going to just very lightly ensure that the balloon is pulled to the bottom of the bladder opening, and it is. So at this point, with the catheter in place, it no longer needs to be a sterile procedure. And I would take my leg strap and I would strap this. Actually, we'll do this on this side so I can hang the bag on the same side. Come here. I'm gonna make sure that that strap is on the leg comfortably. It's a giant strap. That's okay. I'll just leave it like that for now. And then I would hang, the bag would be below the patient's level, below the bladder level, hung on the side of the bed. If I was going to take a urine sample directly from the bag for a sterile sample, this would be the moment that I would do that. But for the sake of this video, I would remove my gloves. I would perform hand hygiene. Well, I would clean everything up, throw it all away. Remove my gloves, perform hand hygiene. Actually, I would clean up the patient first before I did that. Make sure that the patient is dry, that everything is in place, that she's comfortable. And then I would remove my gloves, perform hand hygiene, chart everything that we did here, noting any urine and the color and the characteristics of it, and make sure that my patient is comfortable and at a comfortable position. For the sake of this video, we are going to now move on to collecting a urine sample. So the next thing that I would do is I would check the doctor's order. The doctor has given an order for a urine sample, knock on the patient's door, follow my initial implementation steps. I would perform hand hygiene, put on clean gloves. They do not need to be sterile gloves. I would have my my syringe ready to go. I would clamp off. Let's see, where would I clamp off? I would clamp off like right here. I would clamp off my tube slightly above where I'm going to be withdrawing the urine, so that urine can collect here, and that would be done for about 15 to 30 minutes. So I would clamp here for 15 to 30 minutes and allow urine to collect, making sure that this is at a lower level than her bladder, so it's not flowing back. At this point, urine has collected there. We have had it clamped off. I would take a alcohol swab, and I would clean it, which we'll just do because I already have this out. So we would clean that port. Oh, I'm sorry. You know what? I would have removed that as well. That wouldn't have been on there. Remove that, and then I would insert this. It seems like I got the wrong type of syringe, potentially. So yeah, so for the sake of this video, I would insert a syringe that would have worked. I did ask for the correct syringe. This is not the correct syringe, but that's okay. I would draw up 5 to 8 milliliters of urine in this syringe. So I would draw that up, 5 to 8 milliliters, making sure we've maintained asepsis the whole time. I would have someone else open my sterile tube for me so that we keep this sterile. I would, without touching the edge, insert, and not insert, but then push the urine in. The top would be closed, and then a label would be put on. It would have the provider, it would have the patient's name, it would have characteristics of the urine, where it is going, date and time it was taken, and the amount, and that would be sent to lab. And patient would be returned to comfortable position. And then, in order to continue this video, we've also gotten orders to remove our catheter. So following initial implementation steps, I would introduce myself. I would clarify with the patient what we were doing today, ask if she had any questions. Do you have any questions? No? Wonderful. Looks like we get to take your catheter out. I would empty the bag, the catheter bag, making sure that we measure and chart the amount of output that we had, and then that would go back in place. Hand hygiene and gloves, and then we would put a clean chucks under, make sure that the patient is in a comfortable position, that the bed is at a good height, that she has a bath blanket and is nice and comfortable, and then I would be hooking my syringe back up to deflate my balloon, which may or may not work in this scenario. Let's see. Oh, you don't want to deflate, do you? Okay. Well, interesting. Okay. Well, we might have to, oh, yeah, okay. All right, so I think that the balloon may have been slightly defective. So I would deflate the balloon the exact amount that I knew that I had put into the balloon, making sure that it was entirely deflated. And then that would go trash. And then I would have chucks ready to go to wrap this all in when we are finished. I'm going to make sure that the patient, and then we're going to gently and swiftly exert while she blows out. So I'm going to have you take a deep breath, and then as you exhale, exhale, and we're going to just remove that. And then we would put it into our chucks, and we would wrap it all up, and the whole thing, right, would get thrown into the biohazard. I would make sure that the patient is cleaned, provide pericare as needed, inform the patient that now she will need to be using a bedpan or the bathroom as she's no longer connected to her catheter. And prior to helping her up, I would take my gloves off, do some hand hygiene, and I'd get her comfortable in bed. That would be in the trash. Get her comfy, get her put back to a normal position. And answer any questions that she might have. Do you have any questions? No. And then I would also, bed would go back down to a safe level. Head would come up or down depending on what she would prefer. She also now has her collate. And I'm gonna go document. Clean up. Thank you.